moderator was talking, I feel not me, you know. But go back one slide just to see which photo is better.
No need to ask. The real person is the best.
Good. So related to promoting Sunway University, one of my colleague who come with me from Dubai, she were planning now to put her kids here. So that means you already promoted by hosting this. So keep hosting NCCM events. So actually, I don't have disclaimer or disclosure, but I work with everyone, you know. And this is the spirit we have. And when we go to business, yeah, we are doing business, but I believe it is also the best business ever I have done. Continuation for the professor's slides. He said, okay, we have innovation, we have treatment, but cost always will be an issue. And actually, all my slides is talking about that. So, Assalamu alaikum, I am Nofal, and I will be faster than the scientist because I'm a businessman. I need to make good deal. So it is where? This bottom? This is it. So, okay, you help me. Okay, so about Axios International, it's a healthcare consulting company. We have been since 1997, so we are 28 years plus. And our main services, it is to serve patients. We call it patient access, and I will give you the definition later what we mean by patient access. We operate all over the globe. And with my team, we serve the patient in most of the what we call the emerging markets, so Latam, Africa, Middle East, and also Asia. Can you? I will not promote Axis a lot. We have been a global company for, as I said, last 28 years. You cannot survive in this world if you don't have high quality standard and really you keep innovating. If you don't innovate, you will not survive. No? Good. So this is my sixth slide, but my team has changed how it look at the look and feel. So I used to have it old-fashioned guy, 6 boxes, so they make it much better. This slide, by the way, it is coming from a study. So even in business, you do research, professor, not only in medicine and bioavailability. So, and what was the study? The study is to ask patient. And I said to myself yesterday, I will stop saying patient, so I will say champion. Correct, Saadiya or Saida? So there is a journey which is about 6-station journey, and start by the disease awareness, and then disease diagnosis, then the prescription, and in the prescription maybe you don't feel it, but champion feel it. The one who get the treatment, it is the affordability of this medication. Then to start the treatment, then to comply with the treatment, because there's many challenge champion could face to comply with the treatment and to continue the treatment, where we call it the adherence as well. So this journey, and if you see, I believe they bought here like hospital setting. Most of the stations, I call it station, it is outside the hospital. And this is very important to take in consideration. That most of the work, it is outside the hospital. It is not within the hospital context. And this is very important to take in consideration when you design any service to our champion. So I am, again, old-fashioned, you know. So Malak, who is our global head for excellence and engagement, She said we need to change access definition. So before you look to that, can you go one slide before? Maybe we give some gifts for people who doesn't. So we work on access, and you could see that always, even a professor, he talk about bioavailability, he talk about EGFR mutations, hormonal therapy, and by the way, EGFR, it is crazy as prevalence in Asia compared to our regions and other regions, in the world. So definitely there's something should be done related to that. But everyone will talk about the access. So what's access from your point of view? I will circulate. I used to be a academician, by the way. I don't know why I don't quote it in them. What do you think? What's access? Asil will give gift for who have the right answer.
Working for cost effect.
Working for cost
Effect.
effective.
Equal
Okay.
opportunity for adequate treatment.
Equal opportunity for
Adequate treatment.
adequate treatment. Okay. Yes.
Ease of access and timeliness for treatment.
But you said access. I want the definition of access.
Based on AI. So focus on delivering information efficiently and effectively. Is that true?
Good. So we need to teach the machine, because
Yes.
we keep saying access, but we don't teach the machine what we mean by access. So I will tell you the old definition from my perspective. When I joined Access in 2011, I used to work in military as a healthcare services senior, and they said we work on access. What's access? This is the first question I ask myself. I go to Oxford dictionary, which it means reach, because at that time even Google not similar to these days, and so we don't have ChatGPT or AI. So and I create my own definition by saying it is how you let, I will not say patient, how you let the right champion reach the right treatment. So it is not adequate treatment only, it should be the right treatment. Why I should vote in someone's body molecules just because he cannot or she cannot access another one. So it should be how we let the right champion reach the right treatment. There's 3 rights actually, not the right of the prescription, the 5 rights of prescription, but right time, exactly. Not 10 years later, where they develop complications, and also this is why we are encouraging early diagnosis, means early treatment more effective. So the right treatment at the right time, in the right way. And we mean in the right way, sustainable, which include the cost, include everything. Sustainability is beyond only the cost. So it could be about the supply chain. It could be about you have an infrastructure to infuse immunotherapy, or you have an infrastructure to infuse CAR-T, which is not the case yet all over the globe. So, but this is my old definition, Let us see Malak definition, which is more broad kind of. Because access, it is not only about treatment, it's about diagnosis. It's about after patient or after championing they are in the treatment. So this is the new definition by Access related to the access, which is enable all people. We are talking about people. It's not championing or patient anymore. To reach right quality care And we mean by right quality care means it has standard. And guys, here we are blessed with our healthcare system. If you want to know how blessed you are, I will take 2 minutes more. I don't like these people because it reminds me in the speed fine, you know. So in Africa, it's totally different story. For example, to see the infrastructure of healthcare, to see the referral system. So the right quality care, still the time it is very important. At the right time, at the right place, and this is more convenient. There is some people to take treatment, they need to travel 6 to 7 hours, 10 hours. And maybe when they reach the hospital, oh, sorry, you need to come tomorrow. I go to a city, in a country, I will not expose the city name or the country name, where patients to take their oncology treatment, they sleep in the street. I have seen that in my eye, no one tell me. To take the dose, patient need, because they cannot go back to their village. And they sleep between their corridors. So this is what we mean by the right place, right way. So I used to say right way, we keep the right way, which is convenient, compliant, and customized and personalized. Because we are talking about precision medicine, we are talking about personalization, customization, so the personalization and customization become very important. Can we go next slide? Who tell me the definition, I will give him gifts. Less than 20 bucks to ensure it's not a bribe. I hope that, at least from my session, that when we leave with the definition. And my hope will be, it is the business of everyone, this definition, not only physician, not only businessman. It's the responsibility of everyone to work on, not this slide, I'm talking about, don't, yeah, keep it here, please. Definition of access. Who remember?
Giving the right treatment at the right time and the right way.
This is the old one. Malak will not be happy. Can you recall? Okay. We will try to share even this slide with all of you. This just one slide, and believe me, what motivates 200 people and beyond who work in Axios, and also our partner to fundraise, to crowdfund, to help a lot of patients, it is this definition. And always we ask ourselves, are we with the right direction? So we match what we do with the spirit of this definition. So this is very important to take in consideration. There is inequality issue related to accessibility, and it is the business of everyone. It's not only the SCB or the Minister of Health business. Good, we go to the slide now? This is my old slide. You see the slide I have presented about the champion journey? This is the boxes I'm talking about. So even when you look to the 6 stations, between each station there is different steps. And a lot of our champion could stuck in one of these steps. Yesterday some people, they said, after we got the diagnosis, 2 years we are just in the shock. So we need to understand. And why we have this slide? We have this slide for you, pharmacists, nurses, anyone work in the healthcare industry, or if you are a charity, when you want to design a solution for anything, you need to look from this perspective, not your own perspective. Even, I don't know if there is pharma industry here, Sometimes some of the farm industry, they come to me, we want to do nursing program. Why you want to do nursing program? Because when patient is suffering, they cannot inject themselves. This is your perspective, but patient, they have other options, tablets. So there's no issue. So we need to look from the champion point of view, not only me as a physician point of view. So again, I will repeat it again. You have the disease awareness, the healthcare facility, then the diagnosis or disease diagnosis, and again, you are blessed. I know that some people to reach oncologists, they need to wait 6 to 8 months. Here you just do book appointments, you go next day and you see oncologist. It's not the same. How many minutes left? 5? Okay, next. I will go to the next slide. Yeah, I know. No, so we need to go to that slide. Okay, so affordability and cost, it's a major issue, but there is other issues as well. WHO, and I am not a fan of WHO, this is a disclaimer, but they have very nice study has been conducted to understand the patient needs. And they have defined the patient need under 5 dimensions. And I believe all of us, when we need to offer any solution, we need to consider these 5 dimensions. In New York City, for diabetes patients, most of their focus when they do any service, it was related to patient-related factor. And I will explain more what we mean by these dimensions. They said, no, we need at least to tackle 3 to 4 dimensions. And they have the highest compliance to treatment all over the world. They have reduced the complication and also the cost of diabetes complication by almost 50%. What we are talking about here, that when champion or patients, they are on treatment, they will face kind of challenges, or they have their own needs. These needs, it is under 5 buckets kind of. So, for example, if there is no nurse specialized in pain management, this is not the patient's fault. In cancer, for example. This is, we call it healthcare system dimension. So the idea here that when we want to design a solution, when we want to provide a service, we need to look outside patient-related dimension. What we mean by patient-related dimension, the education level and the knowledge of the patient and their family, where all our focus always, and I hear that a lot over these 3 days, we want to educate the patient. I know some patients, if they sit with their physician, they know more than the physician. The latest update, they know the latest research, clinical trial phase 2, clinical trial phase 3. Because they spend most of their day just reading. And with AI nowadays, it's very easy to collect even at least right information. So it will be, I believe, a gap in your solution or in your service if you only consider the patient-related dimension and you don't consider other dimension. Taking into consideration that, and there is a statement, patient adherence, which is how patients need to cope with their disease. Patient adherence, it's not the patient's fault. It's our fault. It is the surrounding, the ecosystem. So because of that, there is healthcare system dimension. There is as well therapy-related dimension, which is the side effect, the route of administration of the medication, and there is condition-related dimension. Like always I repeat this example, in multiple sclerosis, let us go outside the oncology. In relapsing remitting multiple sclerosis, it is a neuroscience disease. In the condition itself, it has impact on the psyche of the patient. So usually patients, they are on the scale of depression 10 and above, which is very high. So the condition has an impact. The therapy as well has an impact. And the healthcare system, and I believe you could see the one which is separated above here. You have the social stigma, you have the financial, all that, it is under what we call social and economic dimension. Can you go next slide? I will not promote Axios rather than saying we try to achieve the definition. So we try to help all people. For example, here in Malaysia, we have many programs to serve oncology patients. Now we are part also of the Lung Health Initiative, and we do the same in Kenya, we do the same in Malawi, we do the same in Peru. So it's about how we could achieve this definition. Because of that, we run 3 main streams as a service. The first service, it is access to diagnosis, access to treatment, and access to adherence. I have one slide because she wants to kick me out. It's the same. So access to diagnosis, it is how we could let all people reach high quality diagnosis. Access to treatment, how all people reach high quality medications or treatment or surgery. And access to adherence, it is how we cope with the disease. We have been diagnosed, we have the treatment, now we need to cope that this is lifelong. It is not 1 year, it's not 2 years. So how we could cope with the disease, it's not less important than having the medication itself. I don't have more slide, right? I will not say the study because she wants to kick me out. So we run a lot of, one of the really very beauty program, it is peanut tumor, where we call neuroendocrine tumor. This kind of tumor, not even late diagnosis, even if they start the diagnosis journey, it takes usually from 1 to 3 years. Over a solution with, as I said, it's not only the physician business, not the oncologist business. We are able to reduce this timeline from 3 years to 6 months, from 3 to 6 months. But we have involved everyone, even the restaurant beside the hospital. We have involved everyone in this project. So I will not say the case study rather than saying in any solution, we try to involve all partners. And one of the case study for TKI treatment, and Professor, maybe you know, TKI treatment, you have food syndrome, so you can usually to manage this side effect, what we do? I don't know if I will pronounce it correctly, but I could see a lot of ladies. We send to home Budokir and Monokir. These people who, because this is how you could manage the side effect, right? Budokir and Monokir, they call it? Huh?
Pedicure, manicure.
Huh?
Pedicure.
Pedicure and manicure. Okay, thank you all. Thank you.